Abuse and neglect unfortunately does happen in nursing homes, but abuse and neglect in nursing homes are two different things, and families truly do need to understand the difference between the two. Abuse is intentionally harming of a resident. It can be physical, it can be verbal, it can be emotional, it can be sexual, or even financial. Neglect is different. Neglect is whatever a resident's needs are not truly being met properly. So that might look like poor hygiene. That might look like repeated unanswered call lights. That might be not being turned or repositioned, maybe dehydration or weight loss or medication concerns, or even ongoing lack of care that's truly beginning to affect the resident's health or their safety. And here's something very important to remember, that not every bruise that you see on your loved one means abuse. Not every fall means that they've been neglected, because older adults bruise easier. With blood thinners, it can cause some significant bruising at times. Fragile skin, as our elders typically have, it tears very easily. And unfortunately, falls can still happen even if we put every single precaution in place. And so that's truly why context does matter. And so as a family, instead of immediately assuming the worst, you want to start by asking good questions. So some questions that you might ask are, maybe help me understand what happened. What interventions are in place? What is the plan moving forward? So let's say a fall happened and you're like, okay, a fall happened. Is this because you didn't answer a call light? Asking them, help me understand what happened. What interventions did you put in place because of this? And what are you going to do moving forward? And you might even ask, has this happened before? You want to look for patterns, not just isolated events, because neglect is often repetitive. So repeat miscare, repeated concerns, repeated lack of follow through. And if something truly does feel off, I want you to trust your instincts. You want to advocate early. So document your concerns, request a care conference, make sure to speak with your nursing leadership and your administration. Make sure you're documenting all of this, all the conversations, the date, the time, who you talked to, what they said. Take pictures if you need to. But I also want to encourage families not to immediately lead with threats. So don't walk in saying, I'm calling state, before understanding the situation, because it often shuts down communication instead of opening it up. Most facilities genuinely do want to have the opportunity to address the concerns first. Now, if serious concerns are ignored, if the explanation just does not quite make sense, or if you truly do believe that abuse is occurring, absolutely escalate it. Contact administration, contact the ombudsman, who's the middleman between the facility and the state agencies. And so they'll look at regulations, but they also will advocate for the resident, and they truly do advocate for the resident. So it's a great middle ground. But if you still can't get answers that you want, you can always feel free to call state agencies if you feel, because that's your right. That's your right as a resident. It's your right as a family member. You can absolutely call state if you feel there are some concerns. But use those resources as protection and as advocacy tools, not as intimidation. Because the more you call them, the more that state surveyor, as they come in the building, are gonna be like, I'm looking at the same family, the same resident. I've already been here 3 times before. I know this is just a problem family. You just don't want to get labeled like that, because if there truly is a problem and you do need protection, you want them to take you seriously. So don't just do it to try to intimidate the facility. Really use it as protection and advocacy. And also remember this, that most nursing home staff are not abusive people. We don't wake up in the morning thinking, I'm going to go and neglect my patients today. I'm going to go and abuse my patients today. Many of the team members are working in very challenging environments while caring for very medically complex residents. And you can advocate strongly for your loved one while still treating staff with absolute respect. Both truly can exist at the same time. The goal is education, awareness, and protection for your loved one, because the more informed families are, the better outcomes that the residents tend to have. And if you are navigating a very difficult situation and you do not know what steps to take, or you're fearful of, what the outcomes might be, or you don't know how to handle something, I help families through these situations every single day. And so I want you to reach out, because I truly do mean it. You do not have to do this alone. Make sure to continue to follow.